Imagine sitting in a clinical exam room, and the entity that spots this microscopic anomaly in your tissue and cross-references your entire genetic history, well, it doesn't even have a heartbeat.
Right, it's literally just code.
Exactly. And it mathematically predicts your body's exact reaction to a specific chemotherapy drug. The human doctor sitting across from you is really just there primarily to, hold your hand.
Yeah, to translate the machine's absolute certainty into actual human empathy.
Right. They guide you through the psychological weight of the diagnosis.
Yeah.
And this isn't some pitch for a sci-fi movie. This is the reality outlined in our latest batch of source material. It's a snapshot of the rapidly shifting AI landscape from June 2026.
We're really looking at a profound restructuring of human-machine interaction here. I mean, for decades, our relationship with software was entirely transactional and passive.
You input a command and it just does it.
Exactly. You input a command, software executes it, and then you interpret the output. But the sources we're diving into today highlight how rapidly that whole paradigm is collapsing.
We're basically watching software transition from a rigid tool into an active conversational collaborator.
Yeah, one that's capable of independently synthesizing data across all these multiple domains.
Welcome to today's deep dive. If you follow technology, reading the daily news can feel like staring at a wall of static.
Oh, absolutely. It can be totally overwhelming.
Right. You see a headline about a medical breakthrough, then a seemingly unrelated update about consumer electronics, and then a macroeconomic warning about labor markets. So our mission for this deep dive is to cut through that static for you.
We want to connect the dots.
Exactly. We're going to unpack 4 major developments from this June 2026 digest and uncover a clear narrative. We want to show how AI is fundamentally evolving and what this actually means for your daily life and your career.
And I think the common denominator across all these sources is the shift from just computation to actual comprehension.
That's a great way to put it.
Whether the system is analyzing a biopsy or managing a smart home or even fundamentally displacing a white-collar profession, the underlying technology has crossed a threshold.
It no longer just processes our inputs.
Right. It anticipates our intent.
Well, let's start with the highest stakes imaginable, like the biological application. The digest leads with this really significant development in oncology from a team of U.S. researchers.
Yeah, this was a massive breakthrough.
They've deployed an AI model for cancer diagnosis that was trained on hundreds of thousands of pathology images. And the headline takeaway is its ability to identify cancerous cells with just remarkable precision.
It's completely revolutionizing early detection and treatment planning.
But for those of us who aren't pathologists, we need to understand the mechanism here. How is the machine actually seeing the tissue differently than a human doctor?
Well, the limitation of a human pathologist, even a truly brilliant one, is biological. The human eye and brain are looking for specific structural anomalies on a slide.
Like changes in cell shape or something.
Exactly. Irregular borders, obvious morphological deviations. They are essentially scanning a massive, chaotic visual field looking for a needle in a haystack.
Which naturally leads to fatigue, right?
Yeah, fatigue and cognitive blind spots. But the AI model approaches the slide entirely differently. It doesn't look at it in a human sense at all. It performs a rigorous mathematical analysis of pixel-level density.
So it's identifying patterns that might literally be invisible to the human eye. Like maybe a subtle clustering of pixels that correlates with a malignancy, but wouldn't trigger a red flag for a human looking through a lens.
That is the core of the breakthrough, yeah. The model has digested the outcomes of thousands of previous cases, so it maps the pixel relationships in the current slide against this massive, multi-dimensional matrix of historical data.
Wow.
It can detect pre-malignant textures in the tissue sample long before those cells ever mutate into the shapes a human is trained to spot.
You know, I used to think about diagnostic AI as like a superpowered magnifying glass, but that's a wrong way to look at it. A magnifying glass just makes things bigger.
Right, it doesn't interpret anything.
Exactly. This is more like giving a doctor a highly advanced GPS system for navigating a dense microscopic forest. The GPS has already scouted every leaf, mapped the territory of millions of previous slides, and it just instantly highlights the anomalies.
That's a really good analogy. And the digest takes this exact same inferential capability and applies it to chronic illness, specifically personalized medicine.
Which is huge because chronic illnesses are notoriously difficult to treat, right?
Oh, incredibly difficult, because they involve cascading variables. A patient with an autoimmune disorder might have a totally unique genetic profile, a specific metabolic rate, varying lifestyle factors.
Or probably a history of different drug interactions, too.
Exactly. So a human doctor attempting to prescribe a therapy is essentially forced to use a trial and error methodology. The human brain can just only hold so many variables at once.
And, trial and error in chronic illness translates to months, sometimes years, of physical suffering for the patient.
Yeah, while they wait to see if a medication even works or if the side effects are worse than the disease itself.
It's awful.
So this advancement uses AI to analyze vast data sets of patient histories and treatment responses to predict the most effective therapies. It pinpoints the exact molecular intersection where a specific therapy was most effective for that specific biological cluster.
It predicts the outcome mathematically before a single pill is swallowed.
Right. It vastly reduces that trial and error period.
Okay, let's unpack this. If the AI is doing the heavy lifting of diagnosing and seeing the invisible patterns and predicting the exact personalized treatments by crunching a million variables, what exactly is the doctor's role now?
Well, the source material positions this as a massive augmentation rather than a replacement, but it does require a fundamental identity shift for medical professionals.
How so?
For a century, the physician's primary value was raw diagnostic computation, right? Memorizing symptoms and synthesizing data. But if we offload that analytical workload to the machine, the physician's value shifts entirely to human translation.
So they become more like a psychological care manager.
Exactly. It frees them up to focus on actual human-to-human patient care. They can focus on the emotional friction of disease, ethical considerations, and guiding the patient. And what's fascinating here is how the personalized medicine aspect marks a historic shift.
Moving away from broad treatments.
Yes, moving away from broad generalized treatments toward hyper-tailored efficiency based on these vast historical data sets.
The AI handles the data processing, freeing the human to handle the humanity. That's incredible.
Right.
But let's take this inferential power out of the specialized medical field.
Yeah, let's look at the home.
Right. Here's where it gets really interesting. The digest moves us straight from the hospital into the living room. It highlights how this technology is crossing the uncanny valley and mastering our everyday language, not just medical data.
Yeah, the introduction of advanced natural language processing, or NLP, into consumer virtual assistants is a huge milestone. A major tech company recently unveiled a new virtual assistant powered by this advanced NLP.
And it completely discards the rigid command structures we've grown used to, right? I mean, you and I both know the frustration of the early smart speakers.
Oh, they were terrible.
They were basically just voice-activated command prompts. You had to learn their specific syntax. You'd stand in your kitchen and carefully enunciate, like, device name, set timer, 15 minutes.
And if you phrased it casually or if you hesitated, the system just failed.
Right. The cognitive burden was entirely on you to speak like a machine. It was like dealing with a stubborn automated phone menu. But this new one handles seamless conversations for tasks like setting reminders or controlling smart home devices.
Or simply having a chat. It's designed to be highly intuitive and capable of understanding a much wider range of queries.
It's like having a capable roommate who manages the house.
Yeah.
But I have a deeply skeptical question about this.
Okay, let's hear it.
Does making an AI human-like with casual chatting just mean it's better at faking a personality? Or does advanced NLP genuinely mean it understands us better?
Well, advanced NLP isn't just a party trick. It's the literal bridge between human intent and machine execution. Older models used rigid decision trees. They listened for a trigger word, extracted a verb, and executed a hard-coded script.
Right, like hearing the word freezing and giving me the weather forecast.
Exactly. But this advanced NLP utilizes complex attention mechanisms. It doesn't just parse the sentence you spoke, it weighs the semantic importance of every word against the context of your environment, your previous interactions, and even the time of day.
So if I say it's freezing in here, it maps that to my home's thermostat. It remembers I lowered the temperature last night and adjusts the heat without a direct command.
Yes, it bridges the gap between your implicit desire and the machine's execution. And if we connect this to the bigger picture, integrating this level of convenience and connectivity at our fingertips normalizes AI.
It makes it invisible.
Exactly. It makes it an invisible but essential thread in the fabric of our daily lives.
It weaves the technology right into the background of our homes. But, if we take a step back and connect these threads, the picture gets incredibly heavy.
It really does.
If the AI is now capable of handling complex medical data and carrying out seamless, human-like conversations in our homes, What tasks are actually left for human workers?
Which leads us directly into the macroeconomic impact on the job market. The final section of the digest features a recent report highlighting automation's growing impact on employment.
Fundamentally reshaping various industries.
Right. And while AI creates new job categories and opportunities, it poses severe challenges for workers whose tasks are being automated. There's a growing call for reskilling programs and educational initiatives to equip the workforce for this AI-driven economy.
So what does this all mean? I really want to push back on the sanitized language of this source report.
The term reskilling.
Yeah. It's easy for an article to call for reskilling programs. But isn't that an incredibly daunting, disruptive challenge for everyday people? I mean, for you listening right now, if your livelihood is suddenly categorized as an automated task, that's terrifying.
It is terrifying. And this raises an important question. The digest concludes that society is currently in a transition phase. And the overarching problem here is that technology moves faster than infrastructure.
Way faster. Capital and software can scale instantly. A new NLP model can be pushed to millions of devices overnight.
Exactly. But human neurological adaptation, the building of educational infrastructure, the sociological shift required to change professions, that takes years. The creation of new job categories is a promise for the future, but the displacement of workers is an immediate reality.
The AI is diagnosing cancer and managing our households today. The educational initiatives the report calls for are, still being drafted in committee somewhere.
Right. And the success of this era hinges entirely on how effectively societies can deploy these educational initiatives during this crucial transition phase. We are moving from a knowledge-based economy to a synthesis-based economy.
Which is a massive paradigm shift.
It is. In a knowledge economy, human value was tied to data retention and execution. The lawyer who could recall the most case law, or the accountant who could process the tax code fastest.
But artificial intelligence now holds a monopoly on data retention and execution.
Exactly. Therefore, in a synthesis economy, human value shifts to curation, critical thinking, and complex problem formulation.
It mirrors the doctor we talked about earlier. The doctor doesn't compute the pathology data anymore. They synthesize the machine's output with the patient's emotional state.
To formulate a holistic care plan, yeah.
The challenge is trying to figure out how to replicate that dynamic across transportation, administration, customer service, all these fields. We're asking society to undergo a massive structural rewiring while the grid is fully alive.
Which is why those educational initiatives can't just teach people how to use a specific software program. They have to teach adaptability and interdisciplinary thinking.
As we pull all these threads together, I want to quickly recap the journey of this deep dive for you.
We covered a lot of ground today.
We did. We started by seeing AI augment doctors fighting cancer with unprecedented precision. Then we saw it converse seamlessly with us in our living rooms, anticipating our intent.
And finally, we confronted how it's forcing a massive restructuring of the global job market.
Right. And to you, listening to this right now, this isn't just a list of tech updates. This is the blueprint of the new economy and society that you are actively navigating.
Yeah, rules of engagement have completely changed.
Which leaves us with a final lingering thought to consider long after we wrap up today.
Yeah, if AI is rapidly becoming our personalized medical consultant, our conversational home manager, and the catalyst for an entirely new job market.
Where does that leave us?
Are we moving toward a future where a human's most valuable skill is no longer what they know, but rather how effectively they can adapt and collaborate with the AI systems that know everything else?
Wow. It's truly a shift from having all the answers to asking the best questions. Well, thank you so much for joining us on this deep dive.
It's been a great discussion.
We hope it gave you a clearer lens for the changes happening around you. Stay curious and keep exploring.